Welcome. This video provides information on developing the care plan for patients receiving chronic care management or CCM. We have 2 additional videos available for you. The first is an overview of CCM. That video informs you on the 3 services under the umbrella of CCM. This is chronic care management or CCM, complex chronic care management or CCCM, and principal care management or PCM. We educate on patient eligibility requirements. These are patients with 2 or more chronic conditions. You expect the conditions to last at least 12 months or until the death of the patient. These conditions place the patient at a high risk of death, acute exacerbation or decompensation, or functional decline. This is for CCM and CCCM. For principal care management, the single high-risk condition is expected to last at least 3 months or until the death of the patient. The necessity for PCM is either an exacerbation of the condition or the threat of an exacerbation. This could be that the patient has had a recent hospital admission, or the condition, if not treated, could lead to a hospitalization. We provided information on the entities eligible to provide this service. This includes physicians and non-physician practitioners, rural health clinics, and federally qualified health centers. It also includes hospital outpatient departments. Clinical staff can perform the service under the general supervision of a physician. The next video we have is on the initiating visit. This visit starts the CCM process for new patients and those patients not seen within the previous year. The links to those 2 videos are in the description of this video. We also provided a link to the CMS Medicare Learning Network booklet on CCM. We added an additional link to the CMS question and answer document. We have a living question and answer document in our Learning Center. You can go into the Learning Center, choose your dashboard, choose Content Library, and then Assets. Under Assets, scroll down to Chronic Care Management Q&A. The link to our Learning Center is also in the description of this video. This video is on the care planning for the patient. There are multiple items to include in the care plan. The first is the patient problems. This will include problems your office may be treating. It also includes problems being treated by someone else, and it can include problems the patient identifies, but for which they are not receiving any treatment. The next is expected outcome and prognosis. This is your evaluation of the problems and what you expect to happen in the future. You need measurable treatment goals. This could be the patient's weight, could be the patient's blood pressure or blood sugar. It could include a measurable range of motion. Assess and document the patient's cognition and function. Depending on your patient, this could include using acceptive cognitive testing. Assess the patient for both physical and mental functions. Can they take care of themselves? Do they have the cognition and mental capabilities to make decisions and to participate in their own treatment? Identify the patient's symptoms from the problem. Maybe the patient has ingrown toenails. How can you manage the pain and possible infections from this problem? Maybe the patient has increased thirst from the diabetes. Managing symptoms can also include instructions to the patient. This is what they can do to reduce the effects of the problems. Planned interventions can include Medicare-covered preventive care services. Maybe this could be the date for the annual wellness visit, or AWV. Identify who will perform. This could also be diagnostic testing planned for the patient. Identify when this is due and who will perform and manage the results. If it is not you, identify how you will receive that information. Medication management is where you're looking at all the medications and supplements a patient is taking. Things to determine: who ordered, why did they order, do the medications work together? Other questions could be, are there alternatives with less side effects? You would be working not only with your information, but also other information from the patient's care team. Environmental assessment is where you're asking questions about their living situations. Can they get up the stairs into the home? Ask about pets. Can they take their pets to the bathroom? You can discuss the physical aspects of the home, but also other people living in the home. Do they fear that person? Depending on information you received, you may want to have a clinical staff person actually see the patient's living arrangements. If the patient has a caregiver, you want to assess this person. Are they physically capable of meeting the patient's needs? For example, a 6'2", 200-pound husband being taken care of by a 5'2", 100-pound wife. What assistance do they need? Assess the caregiver for the capability of understanding the patient's needs and any instructions that you may provide. Interaction with outside providers will include other providers who are treating the patient. This could include other doctors. It could also include emergency departments, hospitals, skilled nursing facilities if the patient received treatment. Another could be resources available for the patient. Maybe Meals on Wheels to see the patient has good nutrition. Maybe a senior center where the patient can interact with others to help with depression, for an example. You need to determine a periodic review date. Remember, clinical staff can perform services, including developing the care plan. The billing practitioner directs the activities. Clinical staff can provide services under the general supervision of that billing provider. You revise the care plan as necessary. The patient may follow your instructions, and you can remove a symptom or a problem. If the patient identifies another problem, add this to your care plan. Share the care plan with the patient and other providers involved in the patient care. This is the information we have available for you on chronic care management, care planning. If you found this information helpful, please like and share the video. If you do not already, subscribe to our YouTube channel. This will provide notifications when we post new material. Please leave us a comment. We want to hear from you. Thank you for your time.